All right, welcome my friends to episode 732 of Extreme Health Radio. Thank you guys so much for being here. Today we're going to talk about eye health and vision and glaucoma and macular degeneration and all that stuff related to proper vision and what the root cause of it is and some aspects that you may have never heard before, because we've had several eye doctors coming on the show, but I don't think anyone who really puts together all the pieces like we're going to talk about today with Dr. Taylor DeGroot of iron overload, PUFAs, emotional traumas, and our nervous system and all that good stuff. So we'll dive into that in just a second. If you're new to the show, we broadcast once a week. And so our new shows come out on Sunday evening. And we broadcast our best of episodes the other 6 days of the week. So make sure to subscribe on iTunes and or any other place where you can get podcasts, and you'll get shows 7 days a week with new shows on Sunday night. And so today we have Dr. Taylor DeGroot, and I follow her on Instagram, and she's got a really cool page on there. And I originally heard about her from my friend Matt Blackburn, Mito Life Radio, which is one of the best podcasts out there. So check that out as well. But I heard her interviewed on Matt's show, and that's how I became aware of her and her work. So let me bring her on the show and unmute her. Okay, I just asked to unmute. I hope you can do that. Dr. DeGroot, are you there?
Hi, can you hear me?
Awesome. Yeah, I can hear you. Great. Thanks for being here today.
Awesome. Yeah, thanks for having me on.
Yeah, so I was really stoked to hear you on Matt's show on Mito Life Radio and hear about all the dots that you connect, like we we're just talking about before we started recording, how you're connecting a lot of dots. And so I'm curious about your, how you got started with all this and connecting all these dots like that.
Sure, yeah. So I originally got interested in eye health because my dog actually had like a ton of eye problems starting from the time he was only like 5 years old.
Mm-hmm.
Um, and he ended up having cataracts at only 5. And basically, he actually had to have cataract surgery. And then unfortunately, he had like a bunch more eye problems after that too. But that's when I really first started to get interested in everything, and I really wanted to find like um, connect more of the dots and find holistic solutions
Mm-hmm.
to eye
What do you think it
problems.
was with your dog? Did you finally figure it out?
To be honest, like he wasn't really raised on the best diet.
Yeah.
This was like before I knew about, any of this stuff. But obviously, like a lot of the dog food is just like pretty terrible. It's like
Yeah.
the equivalent to feeding your children cereal for like their entire life.
Yeah, I know.
But
It's
I also think it was probably like toxins in the water as well, because neurotoxins especially affect the eyes.
mm-hmm.
And so anything that's going to affect the brain is going to affect the eyes, because the eyes are actually brain tissue.
Mm-hmm.
That's how they develop. They're like an outpouching of brain tissue. So I think a lot of it was the diet, the food, things like that. But yeah, unfortunately, like I wasn't able to really do anything at that point, because I'm pretty sure you can only reverse cataracts when they're like mild to moderate.
Mm-hmm.
Um, Not to say that like you definitely can't reverse it when it gets pretty far, but I think that's when you have the most power to reverse it. So yeah, I mean there's a lot of things I would have done if it had been when I knew everything that I know now.
Yeah. I know it's crazy. The first time I sort of understood about, vision and things, I remember a friend of mine, his dog growing up had cataracts, and I forget what breed it was, but it just slowly and slowly just became more and more blind, and eventually
Mhm.
was just running into things. And, now that I know what I know, it's a synergistic complex, isn't it? Of
Yeah,
like
for
the light
sure.
that we live under and the food and the water, it's all just sort of
Mhm.
bioaccumulating, right?
Yeah, so a lot of it, I think, one part that's overlooked, I think, is the non-native EMF portion of it,
Mm.
because calcium channel blockers actually prevent cataracts. So if you think about it, basically, like if you have calcification, that's going to cause breakdown of the lens protein.
Mm-hmm.
So that's a big part of it. And you even see like people that have radiation and things like that, that actually causes cataracts at a very accelerated rate.
And is that happening? What do you think's happening in the tiny little capillaries of the eye? Do you think it's just becoming calcified and
So some of it, I think, is that you're not actually able to utilize fats properly. There's a lot going on with the metabolism, so you're not able to utilize fats properly, which is, there's also increased lactic acid. People with cataracts are often not able to utilize sugar effectively because we convert carbs into CO2.
mm-hmm.
And they've found that at higher altitudes, cataracts actually appear later. So,
Interesting.
yeah, so there's like the CO2 aspect of it. And then other things that cause it are like high adrenaline. So, if you're constantly in fight or flight mode, um, yeah, so things like that. And the thyroid is especially important to
Mm-hmm.
nourish in order to prevent cataracts.
And it seems like these days, whether it's myopia or cataracts, my mom is dealing with some macular degeneration.
Hmm.
It just seems like with the screen time and with people are reading less books, but they're staring at screens more, and it just seems like that's a big deal because not only do you have the way the muscles in the eye work when you're looking at something so close, but then you also have these blue lit back screens, right, that are
Hmm.
high frequency destroying the tissues in the eye too.
Yes, for sure. I think that's a big problem, especially because like the blue light resonates at the frequency of iron.
Mm-hmm.
And we know that iron accumulates in the eye, especially um, with macular degeneration.
Mm-hmm.
So there's like the iron portion, there's the lipofuscin accumulation,
Mm-hmm.
um, because there's these little tiny things that they call drusen. And this is actually a hallmark of AMD. And what it
Mm-hmm.
is they're like these small yellow deposits that are a buildup of waste material. And we're told that it's just waste and that, we're not really told what it's made up of.
Mm-hmm.
But when you dig deeper, you sort of find that it's oxidized cholesterol, like misfolded proteins, and things like that. So basically, it's the polyunsaturated fats, and this is just building up over the lifetime. We even find small drusen in like 90% of eyes, like very tiny drusen in people ages like even 18 to 50, even age 18, people are having very small drusen found in their eyes. So this is just building up over a lifetime,
Yeah, it's
pretty much.
wild, right? And so
Mhm.
it's just closing off vision. And what does that usually express as? Like cataracts or macular, or what is it?
So I often notice that in macular degeneration patients, because I like to kind of just like see what patients look like when they have these diseases.
Mm-hmm.
And one of the things I noticed was that a lot of the patients that have macular degeneration have age spots like all over the body.
Mm-hmm.
And we know that this is it's sort of made up of the same thing. The eyes are just one of the first places that this manifests and that we can actually see it. So we could see it in the eyes before we see it manifest on the skin as age spots.
Wow, that's fascinating. Yeah. And so
Mhm,
this is just the synergy of like the standard heavy metals, iron overload, cholesterol, fats,
mhm,
estrogens, metals, and stuff that expressing
yep,
as lipofuscin in the eye.
So it's basically like iron combines with oxygen and PUFA,
Mm-hmm.
and then it's spread throughout the body by like heavy metals such as like aluminum, and then UV light from the sun plays a role, but I don't think it's what is to blame because it's not what, like, if UV light from the sun wouldn't have been a problem if we didn't have the iron combining with the oxygen and the PUFA.
Hmm. It's wild because when you think about how smart the body is in order to store fat safe on areas of your body that aren't necessarily necessary for life, and it's incredibly smart, but it's wild that this lipofuscin would accumulate in the eyes, knowing that like we need to see. That's our primary defense,
Mhm.
vision, and it's wild that the body would do that. But maybe it's doing that, and it has really nowhere else to go. When we've been accumulating it for so long, it has to do that or something.
Yeah, I think part of the reason why is because the eye actually makes 8 times more ceruloplasmin than the brain.
Mm-hmm.
So the eyes have like a super, super high metabolic rate. So because of that, it's one of the first places that we see this pigment start to accumulate.
Mm,
And
that's
then when
wild.
we,
Yeah.
yeah, and then when we look at what's protecting us in the eye, I think a lot of times people like overemphasize like the lutein and the zeaxanthin because those are
Mm-hmm.
like big things that people bring up to protect from macular degeneration. But what no one talks about is actually melanin,
Mm-hmm.
because if you notice, people with dark skin, they have more melanin, they actually don't really get macular degeneration. And people with blue eyes and light skin are the people that do get macular degeneration. And so when you look at what melanin actually does, it's actually like an antioxidant, which is protecting you.
Mm-hmm.
So foods like chaga contain melanin,
Mm-hmm.
and that could be super, super protective to actually, protect yourself naturally from macular degeneration.
And it's my understanding too that melanin is partially created in the morning UV sun, right?
Yes. So it absorbs the complete visible light spectrum. It facilitates pineal gland health, and it actually is like an iron trapping agent, which is why its prevalence builds up with increasing iron in the eyes.
Interesting.
So we
So
actually use it to protect ourselves from the oxidative stress.
that's wild. And is this melanin? I'm sure it would be sort of correlated with both wet and dry macular, right?
Yeah, so basically all macular degeneration starts off as the dry form. And then if it continues to get worse and worse and worse, and the blood vessels, basically with wet, there's also neovascularization, which means that the blood vessels are leaking out their contents.
Hmm.
And that's when you're really at risk for losing vision with the wet type.
Yeah, because my mom has been sort of on the dry spectrum for
Mhm,
years, never really progressing. But if it
mhm.
does progress to wet, have you seen any clients be able to reverse that?
Um, I would say it's probably harder to reverse it once it gets to that stage. Um, I know that what they try to do when it gets to that stage is they try to do like injections that release VEGF,
Mm-hmm.
which basically tries to stop the bleeding in the eye because
Mm-hmm.
that's what you're just trying to do at that point to save the vision. So if it does progress to the wet type, I would really focus on things like red light therapy. Um, and I mean, I'm sure like peptides as well would be helpful.
I was just going to bring that up. I've heard people talking about that. Yeah.
Yeah, so there's things you can do. I would probably look at peptides.
Mm-hmm. And do you think that they're like with vision issues? And it seems like when you start studying this, all the stuff that we're into, you realize like I was reading in the book, Magnesium Miracle, and the Merck manual has like 30,000 different, names that they give to diseases. But when you understand the work that we're into, you realize like there's sort of a foundational cause, oxidation and iron overload and this type of thing. And it seems like, I mean, there's macular degeneration, wet and dry, there's glaucoma, there's myopia. Are there like, does it take different things, do you think, to work on all of those things? Or is there a foundational approach you have, and then you can go after targeted things with each one of those sort of labels?
Yeah, I really think there's a foundational approach with minerals,
Mm-hmm.
um, especially with things like glaucoma and macular degeneration. But like you said, there are like targeted things that you can add on to.
Mm-hmm.
Like we know that like with glaucoma, a lot of times I want to start with minerals and the nervous system,
Mm-hmm.
mainly because magnesium deficiency, which a lot of glaucoma patients are, it causes vasoconstriction,
Hmm.
which cuts off the blood flow and the nutrition to the optic nerve.
But wouldn't that
So,
be the same thing for macular? Or it wouldn't be the exact same thing, but magnesium would also help
yeah,
with macular, right?
yeah, for sure. Yeah, for sure.
That's wild. I
But
guess it works in different ways for each thing then, right?
yeah, like there's different ways you can apply it, but it's always coming back to that. So I do agree with you on that.
Yeah, it's just
Um,
it's difficult, isn't it? Because you have one approach, but it's like you're beating a dead horse. You're saying the same thing over and over for every condition, but it really is true, you know?
yeah, I totally agree with that. And
Yeah.
then the other thing about glaucoma that I focus on is actually sleep and your dental health, because what they found is that your eye pressure increases already just by laying down. So even in just the laying down position, the IOP raises.
Really?
So, yeah. So what I'm concerned about with glaucoma patients is what's happening at night is the optic nerve getting perfusion, because oftentimes they find that the pressure can raise from about 6 to 10 overnight.
Wow.
So I think that's where the and if you have something like sleep apnea and your mouth breathing, you're not getting enough oxygen to the optic nerve. And so that's one of the main things I focus on for glaucoma.
And have you heard of, we did a show years ago. I think we may have done two with him now. I forget the guy's name, but it was basically incline bed therapy. Have you heard about that?
Hmm.
And
Yeah,
does that impact all aspects of vision, do you think, or just something like glaucoma?
I think it impacts all aspects of vision because what you're doing with that is you're really helping the lymphatic drainage,
Hmm.
which is basically like the lymphatic system for your brain.
Hmm.
So we know that at night it's the only time that the brain and the eye are able to detox.
Hmm.
And this mainly happens during deep sleep. So a sign that you're not detoxing your eye and the brain properly is if you're not getting enough of that restorative deep sleep.
I looked on your Instagram the other day and you posted a screenshot on your stories of your sleep. And I think it was like 9 hours. I'm like, oh my gosh, you're so lucky. That's awesome.
Yeah, that's like really good for me too. But
Wow.
yeah, I was actually like not feeling too hot, so I like really needed the sleep.
Yeah.
And
I
I
was so
got that.
jealous.
Yeah.
That was
Yeah,
so
I
fun.
don't always get 9 hours, but
Now, do you,
when I do, it's a good day.
yeah, it's like you're going to post it, right? um, when you, or do you do the incline bed therapy, or is that just something you would do if you started to have some issues?
Um, I mean, I probably should do it.
Yeah.
But yeah, I mean, I don't think if I had those issues, I would probably definitely be doing it, yes.
Hmm. Yeah, it's interesting because it's so counterintuitive when you look at it, because most people think, putting your feet up and your head down, but incline bed therapy is the opposite. And, in that show, we were talking about, we took a bunch of listener questions. I think one of them was, oh gosh, like I forget what's it called when you have swelling in your ankles. I forget the name for that.
Oh, like, edema? Or
Edema, yeah.
is
And
it
he was
yeah.
saying that like incline bed therapy is one of the best things you could do for edema. And it
Oh,
sounds
wow.
counterintuitive, right? But
Mhm.
um, it's
Yeah,
it
I
sounds
guess
pretty fascinating.
it's probably just because I don't know if this is true, but I feel like it's because everything flows toward the heart, like all the lymph drains toward the heart.
Hmm.
So I guess if you like raise your head up, it's helping, I don't know, it's
Yeah,
helping everything drain.
yeah, it was really fascinating. What would you say are some of the worst things that you see people doing, or foods they consume, or habitual lifestyle, things they do to harm their eye health? What do you think the worst things are?
The worst things, I would say eating processed foods that are loaded with iron
Uh-huh.
and the fortified foods,
Yeah.
canola oil, seed oils, definitely not good for your eyes. Um, Blue light is another one of the biggest ones, I think, because cytochrome oxidase is one of the enzymes that is damaged by blue light.
Hmm.
and so it's a copper dependent enzyme, so it's also damaged by excess iron.
Mm. Mm-hmm.
So you really want to lower the highly unsaturated fats from those type of thing.
And the blue light too is super high frequency, right? And that's going to have an impact on just the physical structures of your eye,
Yes, for
right?
sure. And also, as well, the blue light toxicity, it actually contributes to the myopia epidemic because the blue light toxicity on the skin or the eyes, because we do have photoreceptors on the skin as well, it
Mm-hmm.
actually ruins the conversion of carotenoids to retinol.
Interesting.
And this causes like basically circadian phase delay. And that's like the underpinning of all the mitochondrial diseases.
So, are you saying that obviously a person that exposes themselves to the blue light, like I've got the iris thing and I'm wearing my yellow glasses right now, and I'm always protected when I'm on the screen. But for people that are not and they're looking at blue light, are you saying that i- if they just like let's say they didn't have the iris on their computer, but they had the glasses on to protect themselves,
Mhm.
the blue light hitting the skin could impact their myopia?
I would say it's mostly in the eyes, but like it's a bonus if you're also blocking your skin
Okay.
from the blue light. And also like the thyroid gland particular, I would focus on blocking it from the thyroid in particular because blue light on the thyroid is super sensitive to that. And that's kind of like running our metabolism as well.
And you think about the people using their phone on full, like 6,500 Kelvin, full blue light, and they're using it at 10 o'clock at night, and they're holding it just like 2 feet from their thyroid, really.
Yes. So I would say especially prioritize blocking it from the thyroid.
Mm. Yeah, because there's not really anything to protect the thyroid. I mean, it's sitting right underneath your skin. So that blue light, I don't, it's my understanding it doesn't penetrate as deep because the frequency is so strong, but the thyroid's not really that deep anyway, right?
Mhm. Yeah, I think it for sure affects it.
That's wild.
Yeah.
So we got the blue light, we got the iron fortified foods, we have the polyunsaturated fatty acids. What else would you say that is really damaging people's eyes?
Definitely stress.
Yeah.
Because, basically when we have continuous stress, elevated cortisol, we're disrupting the blood flow to the eye and the brain. Um, so basically high adrenaline causes cataracts, it causes blurred vision, tunnel vision, light sensitivity. Dry eyes is another big one that's caused by stress because actually when we're stressed, all of our tear secretions are decreased. So we're not secreting enough tears, um, as well as eye floaters too. I think that's a big one people see when they're super stressed.
Oh, really? So there's a connection to dry eyes and eye floaters.
Mhm.
That's interesting. Yeah, because a lot of people are getting those floaters. Some people think they're parasites. Some people think they're, misfolded proteins. I've heard that before. I guess it
Yeah,
could be all of that, I guess.
I think so. I think a lot of it is like the EMFs, oxidative stress, bacteria, mold, cellular dehydration, I think contributes a lot.
Hmm.
Um, I guess like the aqueous actually has a ton of vitamin C in it. So keeping up with our antioxidants really helps. Supporting collagen health. So I guess you can try like the MSM eye drop to support collagen health. I know niacinamide is really good for floaters and eye health.
Hmm.
Um, yeah, and drinking like structured water because we know that as our eye starts to degenerate, what happens is it becomes more liquid in the vitreous, and the water is basically losing its structure and it's losing its ability to support the eye's oxygen demands and nutrient demands as well.
Because the eyes have a huge reliance on lots of oxygen, right?
Yes, yes, because the eyes need a lot more ceruloplasmin as well.
Hmm. Do you think that like the whole Dr. Cruz crowd of the, biohacking field, they're doing the sun gazing in the morning, but they're doing a lot of DHA and fish and stuff like that. And I remember reading some studies, and you kind of refer to this a little bit, where UV light can spread lipofuscin, and I
Mhm.
wonder if all of that UV light, perhaps in the morning, it's not as bad, but Dr. Cruz
Mhm.
is a big fan of that morning sun gazing and stuff.
Mhm.
Um,
I'm a fan of it. Of the I think you can definitely overdo it. I think it also depends on, like, the person's state of health, how well they're gonna take to that. If you're already in, like, if you already have tons of iron overload and lipofuscin building up in your cells, I mean, I obviously still think the sun is super important, but I think it really depends on the person, how much of it they're going to need. And, yeah, so I'll just leave it at that. I mean, I still think sun gazing, can be, like, a really supportive practice for resetting, like, the circadian rhythm and all of that.
hmm
And the red light specifically has been shown to help with myopia control. They've actually found that, viewing sunlight in the morning and sunset actually improves, people's vision with the myopia.
I wonder if a part of that has to do with just being outside and being able to see peripheral trees in the distance and looking short and long distances. But I'm sure it has to do with the light as well, right?
Yeah, I think part of it has to do with how it impacts, like, the thickness of the choroid, because I know that, like, too much blue light can actually increase choroidal thickness, um, and so can, like, doing too much near work and things like that.
Yeah.
And so the red light has actually been shown to really help with that.
So I have a red light device, and so it's like a panel, and I wonder, sometimes I'll look at it, but I won't look directly into the light, but I'll let the
Mhm,
red light hit my eyes. That's probably
mhm.
a good practice then.
Yeah, no, I think that's good. I mean, I think it also depends, like, a lot of people when they first start doing red light therapy, their eyes are a lot more sensitive to it.
hmm
And in that case, if you're super sensitive to it, just close your eyes. It's not gonna, like, do any damage, but, just do what you're comfortable with, I would say. I don't
And
think it would do any damage if you open them.
yeah, I mean, I've had nothing but good effects from it. And something else I just thought of that I see a lot of people doing, obviously, is sunglasses. What are your thoughts on those? We forgot to bring those up.
Yeah, so I think, sunglasses, like, they're useful in certain situations, like, if you're, like, in the desert or, like, you're on the ocean and there's, like, a ton of reflection.
hmm
But I think in general, I think sunglasses can make you more susceptible to get a sunburn because they basically trick your brain into not creating melanin.
hmm
Because when you get sunlight into your eyes, it stimulates melanocyte stimulating hormone, which tells your skin to protect you from the sun and to produce melanin.
hmm
The same thing happens in your eyes. It tells your eyes to produce melanin as well to protect you. Um, so basically, if you're wearing sunglasses, you're just tricking your brain into not protecting you as much.
It's
So if
wild. Oh, sorry.
yeah.
It's just wild how much you see people doing everything opposite, right? Like they go inside and they have the 6,500 Kelvin blue light hitting their eyes, and they're looking at their cell phones, 6 inches away, and then they go outside and they put sunglasses on. It's just completely opposite
Mhm.
of what we should be doing.
It's crazy.
Yeah.
Yeah, and the other thing with sunglasses is that, like, a lot of people notice when they're constantly wearing sunglasses, they're really sensitive to the sun, and, like, it when you get outside in the sun, you're squinting, and I think the reason for that is because it really affects, your adrenal glands, because, like, I really believe that adrenal fatigue begins in the eyes, basically because, the sunlight through your eyes controls the vagus nerve,
hmm
and the eyes are also kind of a window into our nervous system. So if you have elevated stress, you can see this with increased pupil size. because your pupils are dilating because your body is looking out for any threats. So it's in fight or flight mode. And this can also induce like tunnel vision when you're stuck in fight or flight. So
Hmm.
you're less aware of the periphery and you're
Right.
more aware of just like what's right in front of you.
That makes sense.
Yeah.
Wow, that makes sense. And so the adrenals are connected in that way
Mhm.
to pupils and eye health as well. That's wild. I never really heard that connection before.
Mhm. And it's also the vagus is also the epicenter of the mind gut connection. So it controls our digestion as well. So that's probably why when you're super stressed, you're not digesting your food as well.
Hmm. That's wild. Yeah, we try to spend as much time outside as we can. You know, when I'm working inside like this, doing a show, like just before this, we had our academy private call, and that went for like an hour and a half. And, just before, in between that and this, I just went outside for probably 2 minutes without sunglasses on, with no shoes on. And I just kind of looked around, looked at the sun for a second, just trying to reset, and I think
Mhm.
that for me has been a big help. I think just resetting your circadian rhythm, kind of like a clock that needs to be constantly reset over time.
Yeah,
Um,
that's awesome.
yeah. And I'm sure that's something that most people should do more of. Do you think?
Oh, for sure. Yeah.
Yeah.
So I noticed that, like in optometry school, I was getting like a ton of like artificial light when we were practicing because we had to practice on each other.
Oh, wow.
Yeah. So literally, I think one time for like an hour straight, I was just like getting light shined into my eyes, and it was just like so bright. Um,
That's
and I
wild.
really struggled. I remember I really struggled when I would go outside in the morning. I would notice like I had so much tension in my eyes when the light would hit my eyes. And that's definitely because of how the artificial light affected my adrenal glands and that whole HPA axis.
Uh-huh.
So I mean, I've reversed it, and
Yeah.
I can tolerate the sun now. I don't feel that anymore.
And
But
you
that was big, yeah.
and you have blue eyes, right?
Yes, I do.
Yeah,
So
and
I'm
it's
sensitive.
yeah, it's interesting because do you think, well, I guess it would stand to reason that environmental stimulus from um, the natural environment like the sun or cloud cover or refraction or glare, these types of things. Because I noticed that people with brown eyes seem to have less of an issue with, like, for me, if I'm out on a cloudy day, but it's like this, it's kind of thin cloud, so the whole sky is super bright, but there's not one point of focus with the sun. That
Mhm,
to me is like, I'm more sensitive to that than I am if it's just a fully sunny day. And I have blue
mhm,
eyes as well.
mhm. Yeah, I think that's partially due to the melanin part because the melanin is kind of helping to absorb, some of that light.
Yeah,
So I think it's super important for blue for blue-eyed people to, up the melanin.
what do you think are some good supplements? Because I like to take the vitamin E, and I like taking systemic enzymes as well. I don't know if that's impacting my eyes. I have pretty good vision and no real issues. Although I will say though that in the past probably year and a half, I've been using Instagram more, and
Mhm,
sharing on stories and kind of looking at the phone more.
mhm.
And I notice like a blurriness now when I get too close, whereas before I didn't. And maybe, we have twin boys. Maybe I'm stressed out, and maybe it's a combination
Yeah.
of things, but
Yeah, I think that's a lot of that is stress, and it's also but like you said, back to the supplement thing, I really like, for the eyes especially, I like the niacinamide, I like vitamin E,
Mhm.
magnesium. I think aspirin is great, especially for, preventing cataracts.
Mm.
Um, Copper sources, so, like, bee pollen, liver, I think for certain people, cod liver oil,
Mhm.
um, yeah, I like pearl powder, lion's mane,
Oh, and shaga would be good too, wouldn't it?
chaga, yeah, chaga is good for the melanin, and then adrenal cocktails, I love
Yeah.
those.
Do you get
Those
do
are
you
all
make
pretty
those quite
good.
often?
I go through phases with it. I
Yeah, me
feel like
too.
with everything.
Yeah.
I kind of like get into it for like a month and I'm going really hard on them, and then sometimes it falls to the wayside.
Do you do the coconut water for the potassium, or do you do something else?
I usually do the coconut water. I
Yeah.
recently learned you can also use like mineral whey, Capra
Oh,
mineral whey. I heard that was good.
oh, interesting. Okay.
Yeah. So I might try that one.
Now, those things that you just mentioned, the vitamin E, the shaga, what was the other one? Niacinamide, all those things. Would that be part of a foundational approach that you would put every one of your clients on, and then kind of work, like we mentioned before, targeted based on if someone has like wet macular degeneration versus myopia or something?
Mhm. I think a lot of it depends on the client. I like to get like blood work so I can look at their thyroid because I like to prioritize for the client
Hmm.
what's most stressing their body out right now. I think there are foundational things that everyone can do, but depending on what the client is deficient in the most, that's what I want to focus on.
Hmm.
So a lot of times I'll start with like transdermal magnesium instead of like supplemental form
Hmm.
because I think a lot of people are really depleted in sodium and potassium and they're not able to use the magnesium yet if they're
Hmm.
taking it orally. So I think transdermal is like a really good place to start for a lot of clients.
Yeah, and if you do the adrenal cocktail with that, you're going to be balancing your minerals and your adrenals, obviously, and that relationship between the sodium and potassium to be able to absorb the magnesium a little better, right?
Yes, for sure.
That makes
And then
sense.
another thing I like to take into account is dental health because I think a lot of people, when they're looking at eye problems, they forget that basically anything, the mouth is kind of like the gateway to the eyes and the rest of the body. And they've actually linked harmful bacteria in the mouth to like different diseases like Alzheimer's, glaucoma, even things like uveitis, which is like an inflammation in the eye. It's like you're seeing inflammatory cells in the eye.
Hmm.
So even things like that, they've actually found that things like tooth abscesses, infected root canals, that can all kind of get into the circulation because when you're chewing, everything is under pressure and irritation. So the bacteria from any infection in the mouth, especially root canals, is getting pumped throughout the rest of the body. And then so they actually found that there's excess bacteria inside of the mouths of glaucoma patients.
Wow.
So I think that's a big point that a lot of people miss when they're looking at overall health.
Yeah, it's wild. I remember there was a documentary on Amazon that got taken off, and I think it was called Root Cause, maybe. And they did
Yes, I've
all
heard
this
of it.
information and like shocking information about how there's a I forget what percentage of women that have breast cancer and like a root canal on the same side of the mouth
Hmm.
it's side of the breast. It's like it's amazing the connection of it all.
Yeah, it's amazing how like the lymphatic system just connects everything, and that's how things, from one part of the body affect everything.
Yeah. I remember in 2010 I went to our dentist, Dr. Stuart Nunley in Texas, and he removed my root canals. And prior to that, I was raw vegan for 7 years,
Hmm.
like 100%, and it just wrecked my teeth, you know. And so I
Oh
had
yeah.
root canals, and I had all this stuff that had to be done. But it was one of the best things that I ever did, and I can't really place, exactly what it did, but it just feels like it loosens up the burden on your immune system. Like your immune
Hmm.
system has more energy now instead of dealing with that all the time
Hmm.
to work on other, aspects of your health. It was it was profound getting that stuff fixed.
Yeah, I mean, that's amazing for your health because
Yeah.
like your immune system is just constantly fighting that and it's just burdening your system, your entire
Hmm.
system.
Do you notice a correlation with the clients you see that a high percentage of them that have you know issues going on with their eyes also have dental stuff going on?
Definitely. I actually was recently working with someone who had like a horrible dental infection, and now she's dealing with glaucoma.
Wow.
And she had it removed, but it's still, this is something that develops over time. It's not something that happens overnight. So you really have to consider like the entire history of someone
Yeah,
and including that.
that's wild. And we have a bunch of questions that I think we'll get to in a second. But one other question that I wanted to bring up, because I think this is a part of it that I've heard you talk about before, that most people don't talk about. Um, and that is like the emotional traumas and stuff like that, that go on, and people going through traumas, and how that impacts vision. And we've done a lot of shows on recall healing, and it's profound when you start looking at that connection as well.
Yeah, for sure. So one of the things I've personally noticed is that a lot of people say like, "Oh, like my vision didn't, you know, go downhill until I had like a huge emotional trauma and a trigger." Um, Sometimes it's like a divorce or something like that, but that's when you notice, problems happening with the vision. And then the other thing is that what glasses kind of do is they kind of make it harder for us to access emotions, because when you're looking through glasses, you're looking through the center of the lens, and that's called like the optical center. And
Hmm.
so what glasses do is they're kind of like visual confinement, because when you're accessing different emotions and different information, your eyes move in a certain pattern to access that emotion or to access that piece of information. So basically, your eyes, that's kind of like the premise behind that therapy. I don't know if you've heard of like EMDR.
I don't think so. Oh,
It's like eye movement desensitization and reprocessing. So it's like a psychotherapy that enables people to heal from like emotional problems.
oh, wow.
Yeah, and it's fairly new, but basically it's a way to kind of distance yourself from the trauma
Hmm.
and move past it. Um, so yeah, it's basically based off of eye movements and how it uses like the patient's own rhythmic eye movements, and the eye movements dampen the power of the emotionally charged memories of the past traumatic events.
That's wild. I mean, it seems like we should be able to live our entire lives without glasses, and it it's so painful to see like little kids, with glasses. They're 5 or 6 years old, and they have glasses on, and it just seems to me that our eyes should work properly, and we should be able to live a full, long, healthy life with no glasses. Don't you think?
Yeah, I think another part of it that people miss is the connection between um, the growth of the jaw and the palate, and how and your vision actually. Because what actually happens is after palate expansion, children can sometimes have improvement in their vision. And one of the reasons is because when the palatine bones are drawn forward,
Hmm.
the pterygo processes are also drawn forward, and this rotates the sphenoid. And this can jam the sphenoid into a cranial extension pattern. So this has an effect on the ability of the extraocular muscles to function.
Man, that's
Um,
crazy. That's
yeah, so
wild.
basically, it also connects to tongue posture, because the tongue needs to be resting on the palate for the jaw to form properly. And
Wow.
so basically, like, you need proper tongue posture, and the lips need to be gently sealed, and the jaws no more than like 2 to 3 millimeters apart. And so that's why in kids, if you see like dark circles or mouth breathing, that can also be linked to myopia. because you're having the pooling of the blood and poor circulation due to the improper growth of the whole facial structure.
That's wild. And if the myopia is not showing up in the child, it could set itself up to express itself later on in life with further like bad health practices, right?
For sure, yeah,
Yeah,
especially if they're getting enough time outdoors and how much near work they're doing.
that's wild. Yeah, I just noticed a lot of people just needing glasses. And I think a lot of it's, myopia or something where just a lot of people are wearing glasses. All my friends are wearing glasses. Like
I
everyone
know.
has them on,
Yeah.
you know?
I think the screen is just really, really accelerating it at a faster rate because the screen is actually inducing, like, pseudomyopia.
Is it?
So there's, like, 2 types of myopia. One has to do with, obviously, what I was just talking about, like, the growth of the eye,
Uh-huh.
but then there's also a myopia that can be induced from just plain old not looking far away and too much near work.
Um, this kind of leads into the first question that we got, and it just says like easy, affordable fixes. And so we talked about some of the things, like some of the supplements that we would take, and then some of the things that are damaging the eye, whether it's stuff we're looking at or doing. But what are some like little exercises or things can we do that are cheap and free and can help us improve our vision?
Sure, yeah. So one of the things I think is really good is all of us are just doing tons of near work.
Uh-huh.
So one thing that I like to tell people to do is as you're doing near work, find something in the periphery and just notice it. Notice it with your peripheral vision every 5 to 10 minutes.
Hmm.
And then there's also something called like the 20-20-20 rule. And what that is you want to look every 20 minutes, you want to look 20 feet away for at least 20 seconds. And what that does is it just basically vision is like use it or lose it.
Okay.
So if we're constantly relying on only the near visual pathway, we lose our ability to use the far visual pathway. Because
Why is 2020 just sort of like easy to remember, or is there
yeah,
actual?
that's
Yeah.
why it's just
Okay.
easy to remember.
Yeah. Because I wouldn't think there'd be any clinical like reference data based on that, but it just makes it simple, right?
I saw like a really funny, I think it was like a tweet the other day. It was
Uh-huh.
like I follow the 20-20-20 rule. Um, and then it said like I might mess this up, but it said like every something about 20 minutes and then like I run away into the forest for like 20 years.
20 years. Nice.
Yeah.
That's
Instead of
awesome.
looking far away, it was like I'm gonna run away into the forest.
That's classic.
That's
Yeah,
funny.
I guess that's so it's 20 feet every 20 minutes, 20 feet, and just look for 20 seconds.
Yep.
Okay.
It's
Yeah.
just easy to remember.
Yeah. I try to do that. We live in a place where you can look off in the distance and see mountains and stuff. And so whenever I'm outside, I'm trying to look really close and then look really far right after and try to go back and forth. Is
That's
that a,
really
s-
good.
is that good? Or do you think that's a stress to the eye or is that
No, I
healthy to
think
do?
that's really good. Yeah.
Okay.
Because you're kind of exercising that ability because we do need to keep our lens in shape. So basically, the more stressed you are and the older you get, your lens kind of gets more inflexible. So you really want to keep the flexibility between being able to go from near to far and near to far.
Okay. That's
So
good.
that's really good to do.
All right, let's see. Can metal or debris get behind the eye and start slowly degenerating the eye? It's a pretty
Metal
good
or
question.
debris?
I guess that could be
Um,
like even iron overload, right?
yeah. Um, I I mean, if they mean just like if they're like welding or something, and like
Oh,
they get metal in the eye, I don't know.
I'm
I
assuming
would
maybe it's like heavy metals from food,
okay,
maybe.
heavy metals. Okay.
Yeah.
I definitely think that causes oxidative stress and contributes to lipofuscin.
Yeah.
So I'd say yes.
Yeah,
It can definitely cause problems.
and it's wild too because when you were in school, you probably didn't learn any of this stuff, right?
No, honestly, like I'm kind of glad I figured things out when I did.
Yeah.
Because it was a little bit difficult for me, because when I was, like, in that, conventional setting,
Hmm.
mainly because I really wanted to help people with nutrition and lifestyle and all of that, but, the exams, I'm sure they're, like, 30 minutes long, and really because, like, the insurance pays, like, so little to doctors, they
Right.
just try to cram as many patients as they can into their schedule to just, like, make their bottom line,
Right.
and it really just, it doesn't leave enough time to go over that stuff with patients.
And the cool thing too about the work that you're doing is like the body's not isolated in the sense that they try to make you feel like it is in conventional allopathic care, where you're helping people with all of this nutritional work when their eyes, but they're also becoming healthier overall in a ton of other aspects, right? So it's
Yes.
pretty cool.
Yeah, so, like, it's crazy because, like, obviously, like, for example, I'll use glaucoma as an example, but, like, things like glaucoma, I think, the system is really good for, like, acute problems, right?
Hmm.
Like, I got a corneal burn or, I got something in my eye, like, "Can you take this out?" and things like that, or, like, something like a retinal detachment where I would recommend surgery for.
Hmm.
But things like chronic conditions like that, like, obviously, like, you can, put a Band-Aid on it, and, like, for instance, with glaucoma, like, the drops work. It's you can do the Band-Aid solution, but what people don't realize is that the toxicity and everything that's leading to the dysfunction in the eye is happening in the brain as well, and the rest of the body.
Hmm.
So it's like I kinda think of it like you're putting a Band-Aid on it, and there's still problems that are happening everywhere else, and you're just slowing it down or stopping it in one place, basically.
Yeah, it's kind of like your show with Matt, talking about the eye, as a window to the soul or to your health. Like it's true because you can look at like lipofuscin or age spots on your hand, and I have one here, and it's like for every one you have on your hand, you have hundreds or potentially thousands in your organs, but it's the same idea. If something's happening to your eye, it's happening to your brain, but you can't feel it. And I can
Yeah.
see like a liver spot on my hand, but I can't feel it if it's on my kidney.
Yeah, exactly.
So it's a good
So it's
indicator.
like yeah, so it's like everything I think, like, the eyes are probably the first place that we manifest a lot of our symptoms, and so if it's manifesting in one place, it's happening everywhere else too.
What do you think about iridology?
Actually, I'm planning to study it. I know a little bit about it just from like my own studies.
Hmm.
I think it's a tool. I don't think it can give you the whole picture, but I don't think any one thing can give you the whole picture.
Hmm.
Um, I think I kind of think of it as like a tool. It's just like how like in Chinese medicine, you look at the tongue and the
Hmm.
pulse to just get clues into people's health. So that's what I'm planning on using it as, just like another tool in the toolbox.
Right.
Um, I think there are certain things that genetic weaknesses that you can see in the eye. I think there's a lot of nervous system stress. If you're predisposed to that, you can see it in the eye through iridology. And I think iron overload especially shows up in the iris because you see like these kind of dark brown spots.
Oh, wow.
And what I've noticed is that what I've just noticed from like my own experience is that the more marks the patients that are the sickest typically have a lot of marks in the iris
Oh, wow.
and a lot of you can see a lot of stuff going on in there. Even
Yeah.
like stuff with the gut you can see as well. You'll see
It's
like a little ring around the pupil.
I
Or
like your approach because it's like should be it seems to me part of an overall approach, rather than I think we've had some people on talking about iridology and it seems like that's their only thing. But like if you're going to use it the way you're going to use it, where it's part of a piece of a puzzle that you can put together an entire picture,
Mhm.
it seems like it could show some good things.
Yeah, I think that we have like the ability to use so many different indicators of a person's health. And a lot of times we just aren't paying attention enough. But I think the body is always telling us something. It's always, saying like, oh, like this is a symptom, but we can use this symptom to heal.
Hmm. Here's a good question about LASIK surgery, and they just
Hmm.
wanted to know they've had it, and they want to
Hmm.
know what they should do now as a result of keeping good eye health.
Hmm. So I would, with LASIK, I think some of the problems are like complications, which can happen. And one of the big ones that I see is dry eye.
Hmm.
So with LASIK, you're kind of cutting through the corneal nerves. And so a lot of people have dry eye after LASIK, and that's one of the most common complications. So I would do red light therapy. Um, I would also, people say that like the flap, I've heard that like the flap never really heals and it's more just like weaker scar tissue.
Hmm.
So I mean, maybe that might make the eye more susceptible to damage because surgery, it kind of does weaken the tissue. So I would look out for things like that, maybe like systemic enzymes to help the body heal and rebuild. Yeah, those are just a couple of things that come to mind for LASIK.
And when you talk about red light therapy, do you mean like just opening your eyes and looking away, letting that light hit your eye, or closing your eyes when the red light is hitting them?
I think depends on the person how sensitive they are to the light. Um, I think even just closing your eyes in front of the red light is enough,
Okay.
but there might be some benefit to keeping your eyes open for a short amount of time. I don't think it's harmful.
Okay.
I would
What
just do
about
either.
what about using DMSO to improve eye health? Lady B
I've
wants to know.
actually heard that's helpful, especially if you're trying to get something deeper, like you're using not a medication, but you're using like a supplement or something like that, or something to heal the eye, and
Uh-huh.
you add DMSO. I think it probably enhances the effect of it. Because
Now
doesn't
I'm
it like drive stuff deeper into the eye?
Yeah, it does drive definitely things deeper into the tissues. Do you I think there's some DMSO eye drops too. Have you heard about those?
I have. I heard they're good for cataracts,
Okay.
but I don't have like any. I wish I had more testimonials of people who've used them.
Yeah,
But yeah, I have seen those.
I know we've had Dr. Sam Byrne on the show, and he's got like MSM eye drops, and I think he's got some
Mhm.
vitamin C in there as well,
Mhm.
which makes sense. But then we had Dr. Amanda Vollmer, and she has that yummy.doctor, I think her website is, and she has DMSO drops. But my thought was like, I've never tried those, but it seems
Mhm.
like it would sting or burn because DMSO,
Mhm.
burns when it's on the skin.
I heard that they do sting. I think I was talking to one person that used that told me they used them and it did sting.
Okay, well, I'm sure it's like formulated. It's not gonna
Yeah.
poison your eye. It's like, let's see here. Floaters, we kind of talked about that. Tips to help my child with strabismus from stroke,
Oh,
cerebral
yeah.
palsy.
Okay, so for strabismus, it's basically like the connection between the eye and the brain. There's like some miswiring, and there's not the brain is basically shutting off the input from that eye, so the eye is going to drift out.
Oh wow.
That's what strabismus is. So basically, one thing that I heard helps with that is actually neurofeedback.
Oh really?
Yeah, because it can help the brain kind of reestablish the connection. And then also vision therapy. So I would try to combine those two approaches, vision
Okay,
therapy and neurofeedback.
interesting. Okay, let's see here. Off topic, perhaps. Oh, someone wanted to know where I was driving when I made that story. That's
Uh,
that's Dana Point Harbor. Um, Are over-counter reader okay to use for reading? I can read in well light with no glasses. I don't know. Over-the-counter
I,
readers?
over-the-counter readers. Um, I would try if you can not to rely on them too much. Um, Obviously, if you need them, you need them. But I
Yeah.
think I actually heard that like reading like super small print can actually help prevent your eye from you losing that ability to read up close as you age. Just
Interesting.
practicing and reading really small print.
You know what I have a problem with when I'm reading like supplement labels or like I don't know, some really small print on a sticker, maybe on a product or something. And it's like at night we have our red lights on and I just can't see that print, maybe it's the light, but when I get outside in the daytime or something in regular light, I can see it much better. But the red light seems to prevent me from being able to read close up. It's wild.
Huh. Yeah, that probably just has to do with the contrast, because
Yeah.
contrast actually helps us a lot. So that's one of the things. I worked in like a low vision clinic for a little bit.
Uh-huh.
That's one of the things we would always stress to the patients is that like lighting is literally everything.
Yeah.
So
Yeah.
if you have any sort of, low vision problem, if you just get the lighting right, you'll see a lot better.
Most of the
But
time.
also,
Oh, sorry.
sorry,
Go ahead. No, go ahead.
go ahead. But then also if you contrast sensitivity is also an overlooked indicator of actually like the neurons in your retinal ganglion cells.
And what would that indicate?
So it can indicate like a nutritional deficiency if you have low contrast, if your contrast sensitivity isn't good.
Okay.
And it can also indicate exposure to like neurotoxins and mycotoxins and things like that.
Interesting. Wow, the fungal or connection. That's wild.
Mm-hmm.
What are your thoughts about pinhole glasses?
I think they can probably be helpful to some people. The reason why it might be helpful is because you're seeing very clearly when you wear them. It's
Mhm,
taking out your peripheral vision, but
mhm.
that one spot that you're looking through, you're going to have perfect vision through it. So if you use it as a way to like decrease the stress on the visual system, I could see it being helpful.
Because I'll usually do that for like 10 minutes a couple times a day just to kind of do it. I don't know. I just intuitively been doing that. Do you think that's a good sort of practice for 20 minutes a
Yeah,
day kind of thing?
I think so. I think it can decrease stress in the visual system
Okay.
because you're getting a
And
really clear image on the retina.
do you think this is a question about myopia again? I don't think we really sort of tackled this one. Like, can it be reversed, improved?
I think so. Like I was talking about before, I think a lot of us are over minus because when they give you the glasses at the eye doctor, that's really for your worst case scenario vision. And so a lot of people, they're wearing these glasses all the time.
Yeah.
So they're basically using their worst case scenario vision and they're wearing it for up close. So
Wow.
this is a huge stress on the visual system because when you're wearing minus lenses for up close, which you have no problem seeing up close for most myopes,
Right.
and then you're basically what you're doing is you're pumping in all this accommodation and you're stressing out the ciliary muscle, and the ciliary muscle gets strained because it's being overused for the close-up vision, and then the lens gets locked in a fatter shape.
Oh, wow.
Yeah, so basically, you want your eye to be relaxed up close because it's already having strain on it from having to work hard up close.
Hmm.
And so what the glasses do is they just induce more strain because they force your eyes to converge even more.
I see. Okay. That's interesting.
Yeah.
Barbara wants to know, what does it mean when you get double vision in one eye and it lasts for more than 5 minutes?
Okay, so double vision in one eye. Um, so do they mean like they have double vision even after they close an eye?
Gosh, I don't know.
Because with double vision, if you still have the double vision when you close an eye, that means that it's most likely from like dryness or something on the corneal surface. It's not from an issue with like the two eyes working together.
Okay.
You know what I mean?
Yeah, that's
So
interesting.
it's usually it's good. It's basically we see it as good. If you close an eye and you still have the double vision, that's good.
Okay.
Because it's like there's not like an issue in the brain.
Okay, that makes sense.
Um, so yeah, usually it's dry eyes, but I
Okay.
mean, I don't know like that particular situation.
Yeah. And what do you think about eye washes and eye cups and stuff like that?
I've heard of it. I've heard of people saying that it basically just helps like flush out the eye and it helps detox the eye. I haven't tried it, but I have heard that it's like a practice, and
Yeah.
I think I've even seen people using like chlorophyll when they do it.
Wow. Yeah, yeah.
Yeah,
I've heard of people doing like wheatgrass juice and stuff.
yeah, I've heard of that too. I haven't tried it, but
I
I've
was
heard it's
listening.
something people do.
Yeah. I was listening to someone who said they had really great success combining wheatgrass juice in their own urine.
Oh wow, that's
Yeah.
interesting.
I know. I've never heard of
I
that before,
haven't
but
even heard of it.
yeah. And then I was listening to Dr. Jennifer Daniels a while back, and she was talking about was she talking about putting, I think she was talking about putting castor oil in the eye. But that sounds just not very fun to me at all.
I heard
Is it
that's good for dry eyes. They
really?
actually use castor oil in some of the dry eye drops.
Wow, that's interesting.
Mhm.
Let's see here. Let's do a few more because this is kind of going to go on forever. But I don't want to, take too much of your time. Can eye diseases be reversed? We kind of talked about that. Tips for nearsighted people. Do you want to take that one?
Sure.
Tips for nearsighted people.
Um, so if you're nearsighted, you have trouble seeing far away. So most people are over minused, and you're probably doing too much near work. And so basically, with the glasses, what you can do is you can do like a reduced prescription lens, and you can use it in like non-threatening and non-demanding visual tasks.
Okay.
And basically, this is going to work to actually correct some of their nearsightedness, because it's actually making you work a little bit instead of just, you know, putting the image exactly where it needs to be on the retina.
Mm-hmm.
So your eyes actually having to work a little bit again. And basically, I actually have like something on my Instagram actually right now. I put like a link in my bio, and it's like a no BS guide to vision improvement.
I saw that. Yeah.
Um, yeah, so I would start there. Obviously, I think there's a lot more you can do than just that, but that's probably where I would start.
We had a guest. I know you're familiar with Adam from Lifeblood. Are you familiar with
Hmm.
him? Yeah. And I think on that show, we talked about methylene blue. And I believe that he talked about people using that in eye cups diluted.
Oh
Uh,
wow.
and I
No,
don't
he
know.
was asked. Yeah, he was asking me about that the other day. It's funny because methylene blue used to be used in the eye as a dye.
Why did they do
Um,
that?
to visualize things on the eye, because basically what happens is if there's something on the eye, it gets stained.
Oh, right,
Like,
right.
so if there's like dead cells or devitalized cells, the methylene blue would actually stain that so you could visualize it and see what's going on the cornea. So now they actually use like fluorescein and like rose bengal. It's like a
Okay.
different type of dye. But I really don't know why they stopped using methylene blue.
I wonder why. Yeah, because its impact on nitric oxide and lowering oxidative stress and carrying electrons across the electron transport chain and helping create ATP and all these things are obviously very necessary for the eye. And it seems like, I mean, this is obviously not medical advice or anything, but it
Yeah.
seems like it would be something that you could do if you had some real issues. But I don't know.
Yeah, I mean, I don't know. I mean, there's just not much research on it. I've looked it up,
Oh, really?
and yeah, I just couldn't really find like what concentration you would use, because I think the concentration would really matter,
Mm-hmm.
because probably in too high doses it would be toxic.
You have blue eye.
Yeah. I
Never,
think
it's completely tattooed forever.
everything's blue forever. But
Yeah.
I don't know. I think the dose would probably be super important
Yeah.
with that.
And I
So
wonder too, I bet systemically, just orally would probably be better, safer anyway.
I think so. Yeah.
And we've also had a guest on our show a while back talking about, um, let's see, Brown's gas and molecular hydrogen. And he has the machine that we sell in our store, it comes with a like a kit for your eye. So he's like kind of rigged
Mhm.
it up where you can put this sort of glasses over your eye and deliver the gas right into your eye, which I thought
Oh,
was
wow.
fascinating. Yeah, I mean,
That's actually great. I love
yeah.
that for dry eyes. I think molecular hydrogen can be really useful for dry eye.
And you mentioned before hyperbaric oxygen as well, huh?
Yeah, I've heard that can be super good if you have like any form of like a blockage in the arteries or the veins, like a branched retinal vein occlusion,
Okay.
where basically like there's like a cholesterol plaque that
Hmm.
blocks um, that blocks the vein off, and then you have ischemia to the retina, so a loss of oxygen and nutrients. And so if you do hyperbaric oxygen like right after something like that happens, I've actually heard of it gaining their vision back.
That's interesting.
Yeah.
Wow. Do you know what? Here's one. Are I can't even spell or say this.
Ping-
Pinguecula.
Pinguecula.
Pinguecula. What the heck is that?
So they call this surfer's eye
Oh, okay.
because a lot of people who spend a lot of time on the water get this.
Okay.
And it's basically like a fibrovascular growth on the eye.
Okay.
And it's like a growth of fleshy tissue on the conjunctiva. They always blame the sun for it.
Right, right.
But I think it's probably has to do with, the combination of everything we talked about with like the PUFA and the iron overload and all of that, and just like the tissue is already dehydrated.
Uh-huh.
Um, so I think it has to do with that and then that reacting with the sun.
Yeah, because a lot of people blame the sun, but
Yeah, I don't think
and
it's
yeah,
I don't
like
think
in
it's
an
all the
ideal
sun.
world, it wouldn't be the sun. Like we wouldn't have if we didn't have iron overload or PUFA overload.
Exactly.
Yeah,
Exactly.
it wouldn't be a problem.
So I
Um,
think I think it's one thing that's helpful for that would probably just be systemic enzymes
okay.
because it is like a fibrovascular growth.
And do most people get surgery? Is that what they do?
You can get surgery for it. That there's pretty much no other treatment for it.
Okay.
Um, yeah, you can get surgery.
And I wonder too, the calcification and or ingestion of vitamin D and causing further impacts on PTH and calcification, if that
Uh-huh.
impacts, I'm sure that would impact
I'm
the
sure it
vision.
does. I'm sure there's like the calcification part of it too, because that contributes to the cellular dehydration
Yeah. Okay.
and the
So
EMFs too,
the way?
and also the EMFs, which contribute to that.
Yeah, I feel like that's a real big issue most people are not thinking about, you know?
For sure.
Yeah, because we had Martin Paul on the show, professor, and he was talking about the breakdown of the cell membrane from non-native EMF and stealing electrons from that membrane and allowing calcium and iron to get inside the cell where it doesn't belong. And I guess if that happens inside the eye, you could have that same issue.
Mm-hmm. It's interesting because actually with cataracts, there's actually a higher water content because the cell actually takes up water when cataracts are forming.
Really,
Yeah. So that's why I think red light would help with that too, because the red light helps structure the water.
this person Nino wants to know about stigmatisms.
Astigmatism.
Yeah.
Yeah. I got astigmatism.
Yeah.
A lot of people are like say that word wrong. It's pretty funny.
Yeah.
Um, or sometimes they say like I got Cadillacs
Oh yeah.
instead of
Yeah,
cataracts.
that's
It's
funny.
funny. Um, yeah, so with astigmatism, there's a big connection between posture and astigmatism.
Okay.
So actually craniosacral therapy has been found to help with that
Interesting. Yeah.
because you're actually what you're doing is you're twists in the body manifest in the eyes. So if you're able to unwind that twist in the body, you're able to improve the astigmatism.
So you think something like craniosacral would be kind of high on the list of things to start doing if you have that?
Yes.
That makes sense. Okay, cool. People can just look that up. The need for glasses young in life. We kind of talked about it a little bit, but this person surmises nutritional deficiencies.
Sorry, what was the first part of that?
Oh, just the need for glasses young in life, and they're just
Oh,
guessing, is it nutritional deficiencies?
nutritional. I
Yeah.
think that's part of it. Anything that's going to affect the growth of the eye when you're young is going to be super important. But the main thing that affects the growth of the eye is the inputs from the sun.
Okay.
So if you're getting like a ton of blue light, the eye's going to grow too long. And this
Okay.
is what happens with myopia.
Oh, so
So,
it
and
even
then
changes its structure after obviously you're done growing.
So it can change a little bit after you're done growing. That's why there's like kind of two things that affect with myopia. Part of it is like the axial length of the eye,
Hmm.
and then part of it is like how you're using your eyes and like your habits and things like that. And I think the nutritional part comes in with the growth of the eye because like have you ever I'm sure you know about like Weston A. Price and all of that.
Right. Yeah.
And he talks about how like the growth of the jaw is dependent on like the fat soluble vitamins.
Hmm.
And there's like a big connection between how the jaw grows and how the eye socket forms and all of that. So I think, if you're not getting the right download of minerals and retinol from the mother, I think that definitely impacts the growth of the whole of the eyes as well as the jaw and the whole facial structure.
It's wild when you look at children, right? Because they're getting the worst diet. They're not getting any retinol. They're getting iron overload, and they're looking at screens and they're indoors all day. And it's just like this recipe for poor vision. Yeah,
Yep.
it's just amazing.
Yeah, it's crazy. I think there's like a study that said by 2050, 50% of the population is going to be myopic.
50%?
Yes,
Whoa.
which is like
Wow.
staggering number.
That is.
And it has to do with everything, the sunglasses, the light inputs, um, the growth of the eye and, what's happening there. So I think when they say like myopia is genetic, I think a lot of it, what they don't talk about is why is it genetic? And I think it has to do with, the nutrients that are passed down and also the toxicity that you're exposed to during development.
Yeah, it's amazing because that term is thrown around so often, right? Genetic, but
Genetic, yeah.
Morley talks about how in the third trimester of pregnancy, there's this just massive copper and retinol dump that goes to the
Mhm.
fetus, and it's like if it's not there in the mom, the fetus doesn't get it. But and people just say, oh, it's genetic, but maybe it's just malnutrition in the mother.
Mhm. Yeah, and also, I think they found that like strabismus and amblyopia, like
Hmm.
if the mother is put on bed rest, that's when kind of like the motor skills start developing in the child. So
Okay,
actually, they found that if the mom's put on bed rest, it can contribute to binocular vision problems.
really?
Yeah, like strabismus and like basically an eye turn, or what they call amblyopia, which it was it. Basically, what happens with that is the input from the eye to the brain isn't really fully formed.
Uh huh.
So actually, I think a lot of that does the foundations for it are laid in utero, which is
Wow,
crazy.
that is crazy. Okay, let's do a couple more questions and then we'll let you get going with your
Okay.
day. Let's see. Let's see. Okay, so thoughts on the Bates method. Is it worth getting an instructor?
Bates method.
Yeah.
So my main takeaways from the Bates method, um, Bates was all about. A lot of people think they misunderstand it. They think it's all about exercises,
Uh-huh.
but really, what Bates was all about was just decreasing visual stress.
Okay.
And that is like such a big key for a lot of people because we hold so much stress and tension in our eyes. And I noticed this in myself, but literally, like when I go to sleep, when I close my eyes, I notice that like I clench them a little bit.
Yeah.
And that also happens in my jaw and my hips. So it's all connected. And so that's why I think a lot of us just hold so much stress in our upper backs, our necks, our jaw, and our eyes. I think
Hmm.
those are the main places people hold it. And if we could just you know, learn to get rid of that stress and that tension, our vision is just worlds of a difference better.
Mm-hmm.
Um, and he Bates actually found this was just by palming, which is such a simple exercise, where you kind of hold your hands and you cup them over your eyes
Mm-hmm.
and you focus on just like the warmth, and it's just like super relaxing for your visual system and your eyes.
So just
And
putting
so
your hands
even
over your eyes?
yeah, so it's basically called palming, and you're just gently cupping your hands over your eyes, and you'll literally notice if you're constantly clenching your eyes that they literally just like relax. All the muscles relax.
Wow.
Um, and so even something like palming for 5 minutes a day can really help so much and even improve someone's vision, like just by doing that.
Oh, wow. That's so easy. Free, cheap.
Yeah. Yeah.
I mean, that's awesome. Okay, so what are your thoughts on MSM? We kind of talked about that. MSM drops, fulvic, or ozone drops. Is there
I
ozone
like
drops?
You can make them yourself, but you have to have your own machine.
But
Unless you could find a doctor who does ozone, they can probably make you some ozone eye drops. Except the problem would be that it wouldn't be able to like last for too long.
yeah, I was just gonna say because ozone would dissipate, wouldn't it, in the
Yeah, it would
water?
dissipate.
Yeah,
Yeah.
because
You would probably do it in saline.
yeah, in saline or something. Because I know there's ozonated oils and things, but
Yeah. So
hmm,
I think it's helpful for cataracts, for any eye problem really. But you also have to be able to use the oxygen.
right, right.
If you're not able to utilize oxygen properly, it might be like a double-edged sword
Yeah,
kind of
because you could
thing.
further increase the oxidation, right?
Yeah. I think
What?
it depends on the person
Okay,
with ozone.
yeah, with any oxidative therapy.
Yeah, with any oxidative therapy, yeah.
What's this dark black? I love this. Like you can see her eye. She says, "What's this dark black? Let's see here. Dark black spot some kiddos get suddenly in the white part of their eye."
Dark black spot.
I don't
Um,
know.
if it's in kids, I think that can be related to blood sugar actually.
Oh, really?
Yeah, like it's a little tiny black. If it's a little tiny black dot, that can be related to blood sugar imbalances. I learned
Interesting.
that from studying iridology a little
Interesting. Yeah.
bit.
Yeah.
Yeah.
Okay. Final one. Retinitis pigmentosa, RP, rare, or is there any if you have any insight?
Okay. So, my friend Victor, actually, I learned a lot from him about retinitis pigmentosa. I don't know
Yeah.
if you know him, the blind biohacker,
Yeah. Yeah.
but he actually uses peptide therapy. I think that he said that's been most helpful for him. I know he uses like epitalon and BPC 157.
Uh-huh.
I know he probably uses like other peptides too. But what I find interesting about RP is that there's a big like vitamin A connection there,
Mm-hmm.
because basically with RP, there's a suggestion that like the retinal pigment epithelium
Mm-hmm.
is deficient in vitamin A,
Mm-hmm.
but you don't find low vitamin A in the serum. So it might have to do with like the receptor, something about the retinal binding protein receptor and some
Right.
abnormalities with that.
Interesting.
And
Interesting.
like, so it's not that, might not be that you're not getting enough, but the inability to actually use it.
That's
So that's something I was looking into with RP. And then also what's big with that is the blue light toxicity, because again,
mhm.
that ruins the conversion of the carotenoids into retinol.
That's wild. Yeah, and I was reading recently that the conversion, I think, is only like 2 to 3% or something like that on average as it is, right?
Hmm. Yeah,
So
so I think the blue light, like I think sometimes people get, if they eat too many carrots or something, they get like the orange pigment on their soles and stuff like that.
yeah,
So I
yeah,
think if you have RP, there's definitely a connection there between something's happening with the retinol, the copper, not being able to utilize the copper, because I think there was also what they found was that they had basically they weren't able to use the copper and load it into the ceruloplasmin, and I think
Hmm.
that's probably because of the dysfunction in the vitamin A metabolism.
Hmm. Hmm.
So that was just from my research on it.
Do you think there's
Uh,
any issues? Because we're talking today in the academy before our show together. Someone was asking about carrots and beta carotene and stuff,
mhm,
and I was just talking about the conversion being so low as is, but then on top of
mhm,
that, I think it takes like 12 or 13 parts of beta carotene to be converted to 1 part of retinol.
mhm.
And I wonder if people that are following more of a plant-based diet and they're loading up on the carotenoids, I wonder if that's having an issue, or if that is an issue, the lack of conversion in their
Lack of
eyes,
conversion. Um,
causing damage. Maybe, I don't know.
I mean, I think maybe, but I also heard that it can get like oxidized.
Oh, okay.
I don't know how much truth there is to that, but I did hear if you have too much and it's not getting converted, it can get oxidized.
Yeah, there's are
So
you familiar with,
possibly, but that
do you
also
know?
depends on thyroid,
Oh, right.
um,
Okay.
how well you can convert.
There's I don't know if you're familiar with Chris Work. He was the Chris Beat Cancer guy, um, and he was part of his cancer therapy was juicing carrots, and he makes a
Mhm,
joke out of it that he like turned orange from juicing so
mhm.
much carrots, but that's that whole conversion that's not happening, right?
Yeah, I don't think it's a good thing.
Yeah, it's definitely not. Yeah.
Yeah, I don't think so. Because you're not
Um,
able to use it. It's got to go somewhere, I
yeah,
guess.
and if it's oxidizing, that's not good either. Um, Well, I think we're gonna just kind of call it there. We have pages and pages of
Okay.
messages, but where can people find you, and just share a little bit about like what you're doing, and where people can find you and all that.
Sure. They can follow me on Instagram. It's at optimizing health, and there's like an EYE in the optimizing, a
Okay.
little play on words there.
Yeah.
Um, but yeah, that's where I am for now. I don't like have a website or anything yet, but I'm working on that. And I'm going to be seeing clients one on one pretty soon. So I'll be announcing that probably within next couple of weeks,
Oh, that's
hopefully.
awesome.
Yeah.
Yeah, that's great. And right now you have like a little download with the link in your bio, right, for people to get access to.
Yeah, so a lot of people were asking me about this about this no BS vision guide. I got like 300 people asking for it. So I was like, all right, I'm just gonna put a link in my bio,
Wow.
and they can just download it. It'll just get sent right to you now.
Oh, that's cool. And
I
what
set
does
that
it
up.
contain for people?
It's just like a no BS guide to vision improvement. I
Okay.
think it's probably not everything, but I think it's a good place to start if you're looking to improve um, your vision. Yeah.
That's awesome. Okay, so no website for now.
Yes. No website.
Okay, cool. All right. Yeah, I'll put a link in the show notes for your Instagram page, and then people can get access to that. That's just linked to in your bio, right?
Yeah, the link's in my bio.
Awesome. Awesome. Cool. Well, thanks so much for, I'm glad I found you through Matt, and thanks for doing your work. And I'm glad to,
Yeah.
have someone on that connects all the dots.
Yeah, this was a lot of fun.
Yeah. Awesome. So what are you going to do the rest of today? Anything fun?
It's super nice out here today, so I'm gonna try to get a workout in outside.
Where are you, on the East Coast, or are you in the?
Yes, I'm on the East Coast.
Nice, nice. Yeah, it's beautiful weather here, and that's what I'm going to do too. First thing is
Yeah.
get outside.
Yeah, that's what I want to do too.
Awesome. All right, guys. I hope you enjoyed that show. Thank you for listening. I hope you got some insights from that, maybe some ideas for helping improve your eyesight, and some things you can do to look forward to, you know, changing your environment. And that's one of the biggest things. I think that it's really important to make sure that we focus on the foundation of our health, and just avoiding all of the damaging things that are causing eye issues and eye health problems. It's really important to make sure you're doing those so that you don't continually assault your vision while you are trying to fix it. I see a lot of that happening where you keep banging your head against the wall, and you're taking like aspirin, or you're taking white willow bark or whatever, and not realizing that if you stop banging your head against the wall, that's all it takes, and you don't need to take the aspirin. So avoiding all the major things, the polyunsaturated fatty acids, the fish oils, the seed oils, the vegetable oils, the iron, making sure that you're really on top of that. A great way to donate or to get rid of iron is to donate blood. Like that's huge. With one donation, it takes anywhere from, for me, it takes about 7 minutes, but the average is about 15 minutes. You can get rid of 250 milligrams of iron. And so if you do that 4 times a year, you're getting rid of 1,000 milligrams of iron a year. And so I shared on our Instagram recently that that's like an uphill battle, because if you're consuming more than 3 milligrams of iron per day, then for someone like me, that will take about 12 years to get down to 5,000. But with the consumption of 3 milligrams per day, I'm going to be, taking in 13,000 more milligrams in those same 12 years. So it's like it's like an uphill battle, right? But regular blood donations can be huge, and I highly recommend doing them. And as an overall strategy to lower your iron stores, and kickstart your reticuloendothelial system, which is basically activating the enzymes that allows iron to be in process and movement. Because your iron is supposed to be bound to hemoglobin, deliver oxygen, get to the mitochondria, and then get back to the bone marrow to make new red blood cells or bone. But if it's stuck in tissue because ferroportin's not opening up in the cell and iron can't leave the cell, then it's going to get stuck inside the cell. And then if you're exposed to non-native EMF, breaking down the cell membrane, for lack of a better term, stealing electrons and allowing iron and calcium to get inside the cell, then you have even more iron overload in areas of the body where it shouldn't be. And so that's why blood donations are so helpful for, kickstarting the ferroxidase process, the transferrin to transport the iron throughout the body. And so, ferroportin to get the iron out of the cell. And so blood donations are huge. And so I recommend them if you feel led to do them. They're free. You can do them through a number of different places. There's a thing I saw online from my friend Matt where he talks about Venus Pro, and it's like an AI device that will do blood donations, but I don't think they have a at-home kit yet. So that would be amazing though. It'd be even more amazing. This is what would be amazing. Like if you could extract just the iron out of your, blood instead of the full blood, because that way people, all the people with adverse reactions, that'd be so cool to be able to do. But yeah, just doing some of that stuff, I think would be really helpful, minimizing the blue light exposure. Um, and like we all should be using, I use Iris Tech on all my devices. And on our Instagram, we have, I think the third video I have is how to change your iPhone settings to be able to just tap the middle 3 buttons 3 times and you can change it from blue light to red light. And that's been huge, and getting and installing Iris. We have access to that in our store, biochargeme.com, and making sure, like I use Iris at 1400 Kelvin during the day. So my computer right now like is yellow, but I'm also wearing yellow glasses just to further protect my eyes, because we're looking at screens for so long. And you have to look at sort of, your lifestyle and your environment and your habits and the things that you do for many hours a day. You want to make sure that they're either not damaging or they're helpful to you, right? So like looking at a screen is completely unnatural. And like what other time in nature do you look at a light source other than maybe a fire? But you're not staring for 6, 7, 8, 9 hours a day into a fire, right? You look at the moon or you look at the sun, these things, like you don't stare at the sun, right? What other time in nature do you look into a light source? And it's never. But our computer screens and our cell phones are light sources that we're staring directly into. So the things that you're doing every single day makes a huge impact. And so just mitigating that, like right now I'm wearing the raw optics sunglasses or yellow glasses that I wear inside. Those are available, the blue blocking glasses on our store. I highly recommend those, the Iris Tech. And these are just like one-time purchases that make such a huge difference. I like that because supplements, I do recommend supplements and food and all that, but that's, stuff you take every day. But what I like are one-time supplement or one-time devices, whether that's a red light therapy device or that's a, Iris Tech software or the blue blocking glasses. it's a one-time purchase that will last you years. And so I really, recommend investing in your health in that way. And some of the supplements that we talked about in today's show, vitamin E, niacinamide, systemic enzymes, those are all available at Mitolife, and you can use our discount code if you want to get some of those. And I highly recommend doing that. Those are just the best supplements. There's only two companies I recommend in terms of supplements, and that is uh, the Lifeblood company. They have great stuff. We just had Adam, and the show about methylene blue was with Adam from Lifeblood, and he's got a vitamin E product as well. He's got awesome stuff as well as Mitolife. So we have coupon codes for both of those. The coupon code for Lifeblood and the methylene blue is EHR10, and the coupon code for Mitolife is EHR15. And grab some systemic enzymes, grab some vitamin E, get some niacinamide from Matt at Mitolife, and the vitamin C as well. I always recommend everything from food, though. If you can't do the foods, then do the supplements. I do both, and the supplements are great for traveling as well. But like pine needle tea or sauerkraut has tons of whole food vitamin C, as well as like citrus and berries and things like that. Um, so get it from food first, but if you want to go overboard and do more, then do supplements as well, which is what I do and recommend. Because I just think we're living on a planet that's incredibly toxic, from the iron in our soils to the vitamin D supplementation to the lies about fish oil and taking years and years of that. So that's why I recommend Lifeblood and the Mitolife products. So I'll put links to those if you guys are interested at extremehealthradio.com/732. And what I'll do is I'll also link to Taylor's Instagram account there as well. So just remember 732. So it's extremehealthradio.com/732 for today's show page. And that way I'll put links to everything that we're, talked about, and the methylene blue and all that good stuff. So hope you enjoyed that show, and hopefully it gives you some ideas. If you know of anybody with, macular degeneration, glaucoma, myopia, these types of things, detached retinas, I always recommend Taylor, for that. And so just send them this show, and that way everything's available to them, and hopefully it will gives them some ideas to work on their vision and things rather than just getting glasses. Because it's my contention that everything is reversible. You just got to give the body the right environment and the right nutrients and the right health practices, and everything is reversible. You got to believe that. You have to believe that, because at one point in your life, you didn't have any health problems, right? Or whatever health challenge you have right now, you didn't have at one point. So like we talked about during the show, doing eye washes with urine and, wheatgrass juice, that's really extreme, right? And there's nothing wrong with that, but your body's not lacking that, because at some point in your life, you didn't do those and you didn't have the problem, right? So it's getting back to that state. And what I recommend is optimizing your body's ability to make energy. That's the only disease there is an inability to make energy. And as Morley says, clear the exhaust. And that's increasing metabolic function while reducing oxidation. And if you do that properly through balancing your minerals because of mineral dysregulation, you can go so far with your health. And then if you start adding on top of that, shielding yourself from non-native EMFs, your smart meters, your phones, getting a protective case for it, turning off your blue lights and drinking clean water, increasing magnesium, just doing the foundational work. And also forgiving your people in your life, doing work that you love. All of these things make such a huge difference. And I can't recommend or stress that enough, because sometimes you don't even have to do any of this stuff. You have to do it, work a job you love, right? Help people, provide value. These types of things go so far. And I just think it's really worth looking into as part of the foundation, forgiving others and all of that stuff, So again, I'll put links to everything we talked about at extremehealthradio.com/732. Hope you enjoyed the show. If you liked it, please leave us a review on iTunes, or you can purchase through our Amazon link that we have on Instagram. Follow us there on Instagram. You'll see our stories we're posting every day, different studies and memes and all kinds of cool stuff on Instagram. And if you go to our bio there on Instagram, there's ways to support us either through PayPal, going to our store, joining our academy. Some people just buy through our Amazon link right there on Instagram. So that's available in the bio on our Instagram account. So thank you again for joining us. Again, extremehealthradio.com/732. And I will see you guys next week. Thanks for listening.